Welcome, everyone, and I'm going to let Lisa Resnick start with good housekeeping.
Hello, everyone. Thank you for joining us. I'm just going to give a few quick housekeeping announcements. Most of the information you will need for today are in your folders, but if there are any other resources that we mentioned that you want to have, or if you'd rather fill them in online, there are copies on our website. If you go to the go.wis.edu/short course 2023 website, there's a short course documents link that will take you there. Also, if you have any questions that come up throughout the day, you can ask any of the D&I Launchpad staff who are over at this front table or in the back in the hallway. Carmen and Kelly are there to answer any of your questions. If you need the bathroom or some water, it's out this door and to the right. And there are some coffee and refreshments in the back, so help yourself throughout the day. We're so excited to have you here, and I will turn it over to Dr. Mahoney.
Thank you. And throughout the day, you're going to notice that it will be excellently coordinated. And at the end, we're going to thank Felice Resnick again for leading all of that. But I just want you to know that all of the behind the scenes work is thank you to Felice. So we also want to thank the Institute for Clinical and Translational Research and all our volunteers. Big thanks to our Launchpad team and especially Felice Resnick, our scientist with the Launchpad team. And along with the Institute for Clinical and Translational Research, Wisconsin Partnership Program has contributed to the funding of this. I'd like to take a moment to acknowledge the sovereignty of the Ho-Chunk Nation and the land that we are on, that is situated upon the traditional territories of the Ho-Chunk Nation. So the villages and their fields of the Ho-Chunk Nation actually stretched along the banks of these lakes and along the Wisconsin Rock, Illinois, Fox, Baraboo, Trempealeau, La Crosse, and Black Rivers. So a huge part of what is Wisconsin and Illinois. After the War of 1812, the United States, acting through a citizen paramilitary, removed the Ho-Chunk people, resettling them without their consent in Oklahoma. In 1825, there was a treaty of peace where the U.S. government recognized the Ho-Chunk and its sovereignty over the 10.5 million acres of land in what is now southern Wisconsin, and promised that these lands would not be entered without the nation's permission. The Black Hawk War of 1832 led to treaties in 1837 that led to the signing of the land upon which this university is built, with the Ho-Chunk people ceding title to 7 million acres and then all of their territory to the U.S. government. So we recognize their presence and their original claim to this land. I'd like to just welcome you on behalf of the D&I Launchpad staff included here. And our collective background includes experience in dissemination, implementation science, engineering, business, education, expertise, and clinical expertise. So we provide education, this D&I short course, as well as training for scholars, workshops, and design for dissemination tools and other resources on our website. We provide research consultation in helping people to prepare for grants, and particularly thinking about hybrid implementation effectiveness grants. And we provide implementation support with different kinds of funding, primarily our E2I award, which helps scale up non-patentable interventions for use, hopefully across the United States. Our mission for the Institute for Clinical and Translational Research is to discover, translate, and disseminate interventions to improve health and healthcare. Our program centers around building capacity in translational science by training the next generation of biomedical and behavioral scientists, providing investigators and clinicians with the next generation of critical resources, including digital technology and data science, and creating novel solutions to disseminate new innovations to improve healthcare practice. Community engagement and the impact of our programs on health equity are central to our work. So on behalf of the D&I Launchpad, which is part of the Institute for Clinical and Translational Research, welcome to the next 2 days, which I think should be fantastic. Just to give you a few facts about our short course this year, thank you to everybody who's registered and completed your baseline survey. And this is our first plug to remember at the end to complete your final survey so that we can show what we've been able to achieve. So we are 130 attendees from 25 institutions and 30 departments at UW. We have about half of us attending for the first time, with levels of D&I research skills self-rated as primarily in the beginning and intermediate. And what I've seen over the years is that we have been shifting to where we have more attendees who are intermediate. So we have been building our capacity at UW-Madison, which is fantastic. And if you look at the focus on health equity in people's work, 40% strongly agree and 33 somewhat agree that their work, they identify as a researcher who includes health equity in their work. Here's our agenda for day 1 in the morning. Danny Almiral, who I'll introduce in a minute, will be leading us with a very short didactic on thinking about D&I principles and how that applies to what is an intervention in the real world. And that will be followed by Amy Kilborn talking about, so you have an evidence-based practice, now what? Moving from clinical to implementation trials. And after a short break, then we'll have a panel discussion, which is going to give a couple examples from UW-Madison of research that has moved from clinical to implementation trials. So our faculty. Amy Kilborn is the director of the VA Quality Enhancement Research Initiative and a professor of learning health sciences at the University of Michigan. So she oversees all of the query programs for all of the VAs in the country. So I'm sure we're going to hear a little more about those. For anybody who's not familiar, it's an amazing opportunity that the VA utilizes to scale up clinical interventions. The query's mission is to improve veteran health by accelerating implementation of research findings into real-world practice and policy. Amy is also director of the Michigan Institute for Clinical and Health Research Dissemination Implementation Science Catalyst, which is a University of Michigan-wide initiative to promote implementation of evidence-based practices in real-world settings in the U.S. and internationally. Dr. Kilborn has served on research national committees, including the Agency for Healthcare Research and Quality Technical Expert Panel on Learning Healthcare System Core Competencies, and the NIH National Mental Health Advisory Council. She received her bachelor's degree from University of California at Berkeley, majoring in molecular biology and rhetoric, and her master's degree in epidemiology and PhD in health policy from UCLA. Danny Almiral is a statistician and effectiveness implementation methodologist who develops tools to form evidence-based adaptive interventions. Recently has been developing methods to inform adaptive implementation strategies and multi-level adaptive implementation interventions called MAZES, and we'll hear a little more about that. These are multi-component implementation strategies used to guide ongoing decision-making by implementers. such as which strategy to offer which organization, at what level of organization, at what time, and under what circumstances. This includes the development of design and analysis methods for clustered SMART studies and multi-level implementation SMARTs. So Dr. Amaral is a principal investigator of the NIDA-funded P50 methodologies for adapting and personalizing prevention, treatment, and recovery services for SU, substance use disorder, and HIV, and which is housed in the University of Michigan, this center. Lastly, J.D. Smith is an associate professor in the Department of Population Health Sciences at University of Utah's School of Medicine. He directs the Dissemination and Implementation Science Core of the Utah NCI-funded, of the Utah Clinical and Translational Sciences Institute, as well as the Methods Core of 2 NCI-funded research centers. He also co-directs the Health Behavior Intervention, Implementation, and Translation Core of the University of Utah Diabetes and Metabolism Research Center. Dr. Smith is MPI and co-director of the Circle Chicago Implementation Research Center funded by NHLBI that aims to reduce disparities in hypertension control among African Americans on Chicago's South Side. So as an implementation scientist and clinical psychologist, Dr. Smith leads the implementation science activities of projects focused on interventions for obesity, hypertension, cancer prevention and survivorship, mental health, HIV prevention and treatment, among other conditions. He completed his PhD in clinical psychology at the University of Tennessee, Knoxville, followed by training at the University of Oregon and a fellowship at Arizona State University. Previously, Dr. Smith was associated with the School of Medicine at Northwestern University before moving to University of Utah. So we are really excited to welcome our guest faculty who truly are internationally known experts, and we look forward to our first talk, which will be by Danny Amaral. Thank you.